Hi, I'm Jaren Chan from the University of Queensland. In this poster, I'm presenting a quadratic association between BMI and hypothalamic volume in non-neurodegenerative disease controls and patients with MND. The loss of appetite in MND results in decreased energy intake. This is associated with greater weight loss and loss of fat-free mass in patients with MND, both of which are linked to faster disease progression and earlier death. The cause for the loss of appetite in MND is multifactorial. A 2017 paper presented a positive association between body mass index and hypothalamic volume in MND, which suggests that impaired hypothalamic function could contribute to weight loss. In this study, our objectives were to 1. Establish an automated segmentation method for extracting volumetric measures for the hypothalamus and 3T MRI data, and 2. Determine the relationship between body mass index and hypothalamic volume in patients with MND who have intact or loss of appetite. The first step in establishing an optimized automated segmentation method is to create a ground truth. In our case, this is the manual segmentation. Manual segmentation was performed on 32 patients with probable or definite MND, 11 patients with loss of appetite identified using the Council on Nutrition Appetite Questionnaire, or CNAQ, and 17 non-neurodegenerative disease health controls. Using key landmarks to establish the borders of the hypothalamus and fornix, a bimodal delineation procedure on T1-weighted and T2-weighted images were applied to delineate the hypothalamus and fornix. Couple this with joint label fusion, an automated segmentation method, we were able to extract the hypothalamus and fornix for our cohort. Here, the adjusted hypothalamic volumes were contrasted against BMI, fat mass, and fat-free mass. A comparison of baseline characteristics between cases and controls at the time of assessment found no significant differences in age, sex, weight, BMI, fat-free mass, and percent fat mass. We also observed cases have significantly lower CNAQ scores. Participants with a CNAQ score below 29 suggested loss of appetite, and we also see a significant difference in proportions between cases and controls. The literature previously established a linear positive relationship between BMI and hypothalamic volume. We did not observe this in our results. Instead, we found a quadratic association. Moreover, there does not appear to be a significant interaction effect between controls and patients with MND. Decomposing BMI into fat-free mass, we see no linear or quadratic association between fat-free mass and hypothalamic volume. This is also the case for percent fat mass. There is no linear or quadratic association between percent fat mass and hypothalamic volume. The relationship between BMI and hypothalamic volume does not differ between patients who have intact appetite or those with loss of appetite. In this study, we could not replicate linear associations between hypothalamic volume and BMI in patients with MND. Moreover, it does not appear that the relationship between hypothalamic volume and BMI alone can explain the loss of appetite in MND. Importantly, these observations must be validated in a larger cohort of patients. However, we have now established approaches that can pave the way for further studies that consider changes in central pathways that impact appetite in MND. I'd like to thank our funding partners as well as the patients and participants for their contribution. Thank you for your time.